This is Dr. Sajid, and we're going to be talking about another very common condition, which is chickenpox, which is very prevalent at the present time, and this is indeed the season for it to be around. And so we thought we could discuss this at the present time. So it is a viral condition. It is fairly common. The commonest age is childhood, and that is when children go to school. But it can occur in the first year of life and also can occur in grown-ups, adults and adolescents. Actually, at this age, it is more severe and can cause complications. It, of course, does not mean that it cannot occur in the newborn period. It can, and it does, especially if the mother has the chickenpox a few days prior to delivering the baby, and then the baby can get it and the baby can be quite sick. Also, it is transmissible through the mother to the baby, and this can happen when this occurs earlier in the pregnancy, and then the baby will have a number of complications because of this disease being transmitted through the mother. So it is a virus, and it takes about 2 weeks or more, 2 to 3 weeks, for the virus to incubate in the body. That means that it takes 2 to 3 weeks from the time the virus enters the body for the symptoms to appear. So the symptoms are generally very mild and sometimes very difficult to distinguish from other viral conditions at the initial stage. So the child may have a little bit of discomfort, may have a little bit of fever, perhaps a little cough and cold, and the child is uncomfortable and cranky, and then soon gets a rash which is reddish, slightly raised, separate one from the other, and it is generally present on the covered portions of the body, which means the front as well as the back. There are fewer rashes on the arms, but it does present itself on the face. It can affect the ears, it can affect the eyes, it can affect the scalp, and the child can be miserable from some fever, itching and discomfort. The characteristic thing about this particular rash is that if the doctor examines this rash, then he finds that within the same place there may be a raised red rash, and this becomes fluid filled, initially clear fluid filled, and then milky white fluid filled vesicles. So they may all be present at the same time on the same spot. So this comes in series or in crops, as we call it, and this lasts about 5 days or so, and then scabs form, and once scabs form, then this disease is not contagious anymore. So how does it spread? It spreads to some extent from very close contact from the respiratory tract, but more importantly, it spreads by contact, that is, come in contact with another child, and a child is most often the one who is infected from another child. So it is a contagious disease, quite contagious actually, transmissible from one person to the other. A lot of people, especially mothers, will tell me, well, it's a mild disease, so why worry about it? That is true in most instances, but we as doctors see children with complications from chickenpox. Sometimes the brain gets involved, the lining of the brain and other parts of the brain. It can also cause pneumonia, and those who have deficiencies of immunity or are malnourished or have other conditions, it can cause pneumonia, and it can cause liver problems, and a child may also develop walking disability after this particular disease. So it can be a severe disease. It is mostly mild, yes. It is, however, preventable. So we want to prevent it with a vaccine. The treatment is very simple, of course, and the doctor will give the child some medicine for itching, making the child comfortable, give some medicine for fever, and occasionally, of course, in severe cases, some antiviral treatment may be given either by mouth or injections, depending on the severity. So the vaccine that I was talking about is reliable and effective and safe, and it is to be given at 1 year of age, and then the second dose can be given as early as 3 months after the first dose, although there can be a longer gap. But this is a very effective vaccine, and it is best to take this vaccine beginning at 1 year of age, and this will prevent a child from getting chickenpox. So in summary, chickenpox is a mild disease, contagious, caused by a virus, but it can be serious, and therefore it should be prevented. Prevention is available, and that is in the form of a very safe and effective vaccine. I hope this information was of use to you. We'll talk about other conditions soon.